Hey everybody, this is Dr. Marino here, and this is my buddy Steven, and he's a great patient of mine. He's come in with neck pain, so he's going to talk a little bit about what his problem is, and we're going to demonstrate a treatment today. So as a ChiroTrust doctor, I just want to disclose that I've taken the pledge not to do any unnecessary long-term treatments. So we'll just ask Steven a couple of questions here. Steven, what brought you into our office?
I came in about a month ago with severe neck pain whenever I turned my head to the left and the right, and I've been coming for about 11 visits now, and the pain decreased like a crazy amount. I'm in basically like no pain now. The treatment's awesome. Coming 3 times a week, and I'm feeling a lot better.
Yeah, so we've gotten about 10 visits under our belt so far with Steven. You can see Steven is quite muscular, so he's kind of beating himself up. Yeah, flex for me. He's beating himself up a little bit. There's some degenerative disc disease in his neck that's causing some flare-ups for him. So I think we're getting this under control. He's on his way to the Bahamas now for a nice vacation.
Feeling good,
and
pain-free.
We're gonna show everybody the treatment at this point. So I'm just gonna put the video camera down, my phone, I should say. And Steven, I'll have you go face up for me, okay? Move up a little bit for me. There you go. So everybody can see that I'm not the actor. Steven's a natural, but I am not. So the first thing we're going to do is we're going to apply a gentle diversified adjustment to his neck. And depending on the condition, I will treat each patient differently. But we're just palpating for motion. And we're going to put a gentle pressure, just relax that shoulder. And a gentle little adjustment into the neck, just to restore some motion to those stiff stuck joints. Perfect. The next adjustment we'll do everything okay with that, Steven?
Yeah, it felt good. It felt really good.
The next adjustment we'll do is I'll have you sit up, move up a little bit. And nice and relaxed. Bring that chin down. I'm just going to bring him back on the table. Breathe in, let it all the way out, and drop back. This restores some movement to the upper back, which influences the neck. We'll do a little stretch. And let's have you go on your belly this time, Steve.
Yep.
Now I'm going to apply my famous technique. Most doctors do the regular adjusting. I do Cox spinal decompression manipulation. This is
Feels amazing when you do this. Feel my whole neck like stretching.
So yeah, what we're doing, as Steven said, we basically are attempting to separate each of the spinal vertebrae. And sometimes this is the only treatment we do. Very often this is the only treatment we do with patients that are just intolerant of the regular traditional diversified adjustments. So what I do is I make a gentle but firm contact underneath the skull, and we apply a gentle long y-axis traction to the neck. Research has shown that the pressures within the discs are decreased, so it's almost like taking some air out of a balloon, and that will help the discs to retract back into their normal spaces. We open up the tunnels where the nerves lie. And what we're trying to do is, again, just restore normal motion to the spine. Nice, gentle. The movement is slow and controlled. It's rhythmical. And it is designed to stimulate receptors within the joints to relax muscle and further restore motion. And Steven's right on track. The research indicates that most patients should receive maximum improvement in about 31 days or about 13 visits. And of course that varies with each patient. After you do the long y-axis traction, you will gently take the spine through the normal ranges of motion. Again, trying to restore the maximum amount of mobility and movement through each of the spinal segments. So I'm at C1, 2. Now we're moving down to C2, 3. And mid-cervical. And I'm just palpating, feeling for the areas that aren't moving real well, and then I'm just trying to get a little more motion through there. And again, just trying to restore some mobility to this area. He's so muscular up here that it's creating an imbalance and a tension on the neck. So we've given some home exercises to do, and Stephen's going to work smarter in the gym.
Oh, that's smarter.
And he is on his way. So just nice motion here. What I will do now, just to work on some of these tender points in the muscle, I'll use a gentle instrument, and it just puts it's almost like a vibratory massage. I'll just work into the muscle. I'll put a gentle adjustment into the muscles and the joints here. Now I'll have Stephen sit up for me. Nice and easy. Good. We'll sit on this part of the table. So what we'll do now is I'll stretch this upper trap and levator. So we'll have him turn. Big breath in, let it all the way out, and relax. So I've taught self-stretches here that he's doing at home. Go the other way, breathe in, let it all the way out, exhale. Good. And then nice and sit up nice and straight. Gonna go straight lateral, breathe in, let it all the way out. And then opposite side, breathe in, let it all the way out. Because we live in a forward-facing world, we tend to bind up and then tighter to the front. So we're going to just open up that chest cavity, stretch out those pecs. Breathe in, let it all the way out, exhale. And we'll get a little more out of that. Push your elbows together, push, push, push. Push, push, push. Breathe in and out. Exhale, contract, relax technique that helps to further facilitate the muscle stretch. Hold it for 18 seconds. Perfect. We'll have Stephen stand up now.
Feel great already.
Yeah. Stephen's doing good. Move forward a little bit here. So now what we'll do is, I'll just do some posture specific work. So you'll bring that chin back, retract the muscles this way, and we'll stimulate the posture receptors in the upper neck. These are the receptors that are stimulated when we're going around sharp turns in our car. We tend to lean into the curve. Good. Look up toward the ceiling. Retract. Just to stimulate the posture receptors for better position. Okay, bring your chin downward and up. And up. Doing okay with that?
Yep, perfect.
Awesome. So here's my star of the day.
It's me.
Look at this guy, huh? Huh? Yeah.
Feel great.
This is what I dream to be of right there.
Thank
All
you,
right.
doctor.
Well, thank you, Stephen. Okay.
Take care, guys.